Periodontal disease, or PD, is one of the most widespread health conditions in companion animals, affecting up to 80% of dogs over 2 years of age. Canine periodontal disease is a progressive inflammatory condition initiated by the accumulation of microbial plaque on teeth. If left untreated, gingivitis can advance into periodontitis, resulting in irreversible damage to the gums, periodontal ligament, and alveolar bone. This disease not only causes oral pain and tooth loss, but also contributes to systemic inflammation, impacting the heart, kidneys, and liver. Our review emphasizes that PD isn't merely a result of poor dental hygiene or aging. Genetic factors also play a substantial role. By identifying gene polymorphisms that influence immune responses and inflammatory pathways, we can begin to understand why some dogs are more vulnerable than others. Extensive research has linked various cytokine and immune regulatory gene polymorphisms to susceptibility to periodontal disease in humans. However, in veterinary medicine, the genetic dimension of PD remains underexplored. Our review identifies a significant research gap in canine genomics, particularly in studies examining genetic markers, such as single nucleotide polymorphisms, that could predict PD susceptibility. It also emphasizes the importance of considering breed-specific predispositions. Small dog breeds like miniature schnauzers and toy poodles are overrepresented among PD cases. This may point to underlying genetic differences in immune function, bone metabolism, or oral anatomy. Furthermore, genomic medicine opens new doors for preventative care. Through early detection of genetic risk factors, veterinarians could implement personalized dental care plans, targeting high-risk animals with more frequent monitoring and tailored interventions. However, the review also has some important limitations. Most studies to date lack large sample sizes and breed diversity, and there is a limited availability of canine genomic databases compared to human medicine. Moreover, environmental factors such as diet, oral microbiota, and hygiene practices also interact with genetic predispositions, making it difficult to isolate the contribution of genes alone. In conclusion, this systematic review underscores the need for expanded genomic research in veterinary dentistry. A better understanding of the genetic basis of periodontal disease will enhance early diagnosis, facilitate the development of targeted therapies, and improve long-term outcomes for dogs. Genomic medicine is not a distant future, it is a present opportunity. By integrating genetic insights into clinical practice, veterinarians can move toward more personalized and predictive dental care.